Olsem Wanem. February the 4th marked the World Cancer Day. In this episode, we give you an insight on some of the most heartbreaking yet challenging realities of dealing with cancer.
She's my hero, really. She's amazing. Excuse me. Yeah. It's been a very difficult, experience, and I've learned a lot. For family, and it just, kind of refocuses your outlook on life.
In 2014, 4-year-old Thoa Manoga from Sepik and Central Province was diagnosed with a rare bone cancer called Ewing sarcoma. For Father Patrick, the news was too shocking and beyond belief.
It was like a slap in the face. I couldn't believe it. I didn't want to believe it, I think it started when she was very little, maybe in the early stages. But because of the situation in PNG, we couldn't detect it. So last year, when we were at home, Aroma, my daughter she was playing on the beach. So a wave hit a little sandcastle bucket she was playing with, and it hit her knee. And then I think that aggravated the cancer was already there growing. We wouldn't have known, We got icing and all that, and we left it. After a week it went down, so we didn't think too much about it. 2 weeks later, I don't know, for some reason she fell again at school and hit the exact same spot.
Following this incident, Thoa Manoga was diagnosed with a rare bone cancer called Ewing sarcoma in her right thigh, a cancer common among children and teenagers. To add on to this shocking news, the family then had to struggle through in getting treatment overseas.
My wife and I, all we could, every time I tried to try to talk to her, I couldn't stay strong enough to complete, but like I said, that's why we need professional people who deal with these things to actually try and, break it down to simple forms like how they do in, other countries.
Thoa Manoga is currently undergoing treatment overseas and will continue to do so in the next 5 years.
We went down in July last year, and then she had the initial 3 months of chemotherapy, quite intensive. In November, on the 13th of November, she had to carry out this radical procedure called rotationplasty, which involves part of the knee. Because it affected the inside of the knee, they had to amputate above and below. So they took the whole knee out, and what they do is the remaining leg, from the rest of the shin bone going down to the foot, they take that and they rotate it 180 degrees. So now her right leg is shorter, and it's also been fitted backwards.
Bone cancer, the name itself states that it is a cancer that arises from the bone. Okay, so cancer that arises from the bone. The bone itself is a big structure. So you see the big solid bone outside. Inside the bone, you have the bone marrow. Okay, that bone marrow is responsible for producing all our bloods. It's like the factory to produce bloods. Okay, so cancer of the bone can come in two ways. One is the one that arises primarily from the bone. So it starts from the bone and it comes. That's primary bone cancer, we call it. The other one is cancer from somewhere else, like from the lungs or from the breast or from the cervix, but decided to spread, so it went into the bone and affected the bone. So it's called secondary bone cancer, which is, we call it malignant in the medical term. Malignant means it spread to the part of the bone. Okay. So the primary bone cancers, one of them is called Ewing sarcoma. Okay. So Ewing sarcoma is more common in younger children, probably age 10, and goes up to adolescents, young adults, so maybe up to about 30 years old, from 10 years old to 30 years old. It's more common in them. We don't see a lot of them in this country, but we do at least see some. The older adults don't really see that kind of cancer. And then maybe just a little bit of percentage, maybe 10% is found in elderly ones, those who are over 60 years old. So that's Ewing sarcoma, and it's the second commonest bone cancer that affects human beings.
She's an amazing little girl. I mean, from all the photos you'll see, she always had a smile on her face, even though, and the chemo, it changes your body. And at times she's really down, but every time you're there, she's cheerful, happy, good to go.
Welcome back as we look at cancer in PNG. Now here's a story of a mother who wouldn't stop smiling nor quit from her fight against tongue cancer, despite challenges in accessing health facilities and treatment.
Really, to have cancer, I never thought it would happen to me or for me having that. But it started after I wanted to go for a throat checkup at the ENT clinic at Port Moresby General Hospital, for my throat, not for my tongue or anything. Okay, while I was there, the doctor tried to, check me. So I was told to, go back and see the ENT specialist. Those are the doctors that check the ears, nose, and throat, whatever. Anyway, during the check, doctor found out that he was in the process of pushing some spatula in to move my tongue. In the event of doing so, I was in pain. So I was thinking, okay, now that pain, the doctor said, people don't feel pain when they have throat problems. It's normally your throat when you swallow food in. So he said, there's something more to it than your throat problem. So I closed my eyes and I asked the doctor again, doctor, is it fatal? He said, well, all cancer is fatal. So I said, okay, I didn't talk. Radiation, we have only one place that we can go to, and that is in Ley. And here we don't have that radiation here in Moresby, and also chemotherapy here, they've run out of drugs. So they had to refer me back to Ley. And to get that, if the doctor refers you over to a certain place, they are the ones that provide the tickets for you to go and all that. But in this case, they said if you want to help yourself, you get it yourself, because if you wait, it will take forever. The treatment, it's free. You just pay for maybe, if you have they need to put you on some antibiotics and all that, you normally pay 2 kina or like that for the medication. And for the radiation, it's free because you have been referred from this. But if you go from a private, I think you pay some certain fees. In my case, for my treatment, I went over with my husband. We spent nearly close to 15,000 or something just to go over and get the treatment and the everyday food and the accommodation and all that. My children are the girls, the things that keep me going. And I thank the Lord that I have these 3 girls. And what really pushes me to carry on and to raise funds to go overseas, which I'm currently doing right now, is to live to face them grow up. So that's the thing that keeps me going. The doctor said we have to refer you to the Philippines for more treatment on that, and you have to go as soon as possible.
If somebody has a cancer, okay, it's not only that person who's affected, it affects the entire family. For example, if somebody is the breadwinner of the family and if he gets cancer, one, he has to undergo treatment, he has to recover from it, and it depends on what stage the disease is. And so from that patient point of view, it is his physical ailment, and because of his physical ailment, his family, his spouse has additional responsibility of taking over the family and financial burden, because treatment of cancer is expensive, because the medicines are expensive, surgery is expensive, the radiation is expensive, therapy is expensive. Some treatment modalities are not available here, so they'll have to fly to other countries for treatment. So the cost goes up. So it's a physical burden, emotional, spiritual. The burden is extensive. And people who have gone through, if you talk to them, they go through a real tough time to deal with cancer, and some of them have come out very strong because of strong family support, and they've helped them to go through this time of hardship.
Musician, singer, and vocal fusion judge Liza Vulacoro is a mother of 3 sons, aged 32, 23, and 7. She is also a cancer survivor. After giving birth to her youngest son at the age of 47, she found out that she had cancer.
We only know cancer happens only to other people, The first reaction of my first reaction was, no, can't be, it only happens to other people. I am very healthy, and I've always eaten the right food and do my exercises. I had my scan, and they found out there was a growth on the right-hand side of my brain. It was quite a big one, and it was going to a stage where they have to remove it. If not, I will die. The chance of living or dying after the operation. And you know what I said to myself? God, dying is not an option. Never. I'm not going to die from this, because you gave me this baby at 47, and you are going to give me back my strength. He needs me. So that's what I said in my prayers, and I just stayed positive, and I know I've got to gain my strength, and I did. And I got my strength back, and I thank God for that every day. Yeah.
Now we take you to Lays Angau Hospital, to the only cancer referral treatment facility in PNG, where cancer patients come from all over the country to get treatment. Papua New Guinea's only oncologist over the last 10 years, Dr. John Niblet, explains that cancer needs a combination of treatments to cure the disease, but preventing the spread of disease during the early stages can help in treatment.
Treating cancer in Papua New Guinea has been an ongoing concern for Angau's cancer treatment referral. Angau's facility treats patients from all over Papua New Guinea. It's the only referral for chemotherapy and radiation therapy.
It's always full. We have a total number of beds of 36, but generally we have patients in other wards we're trying to treat as well, so a fair average would be 40. And the number of patients that we see in the outpatients each week, including treatment patients on radiotherapy as outpatients, would be at least 50, maybe 60 some weeks. So we are pretty busy, and we don't have a lot of time to spend doing what we'd like to do, which is training course.
The only specialist in the country for a long time, oncologist Dr. John Niblet, in many occasions has raised concerns about the treatment of cancer in Papua New Guinea, especially cervical cancer that kills around 1,500 women per year.
At the present time, because of the lack of facilities and the lack of manpower, is to do the best we can for the cancer patients that we see and try to give them the best chance we can with a combination of chemotherapy, radiotherapy and surgery in whichever order is appropriate at the time.
Dr. Niblet is currently out of the country for holidays, but in this interview a year ago, he highlighted some of the needs of the Angau Cancer Treatment Facility, most of which have remained the same. On the eve of receiving a new cobalt machine for the treatment of cervical cancer, Dr. Niblet brought to attention that preventing the disease can contain it. He attributed the risks of the disease numbers increasing because of lifestyle changes in society.
The traditional diet of people who normally eat a lot more vegetables than meat, in fact, does change when the diet changes within a generation. And we may be seeing much the same thing here in Papua New Guinea. As you know, there's a lot of sugar in the diet. People love to drink Coca-Cola and Sprite and all those sort of things.
In the Angau cancer wards, an estimated 40% of patients are suffering from cervical cancer. These statistics have gained the attention of newly appointed acting Angau CEO, Dr. Jim Abrams, who, with the backing of the new Angau board, have begun plans to construct a more modern facility.
And over here, our cancer center, okay? Multiple buildings which will house clinics, it will house everything the cancer center needs, plus it will also be an accommodation block.
But the treatment of these patients need more to be done in terms of equipment and machines to carry out a combination of treatments.
We need to treat them with radiotherapy, we need to treat them with chemotherapy. Unfortunately, most cancer patients have a low blood count. And when you're treating patients with chemotherapy or radiotherapy and they have a low blood count, the outcome is very poor most of the time. And that's what's been happening. So what we need to do is to first transfuse the patients with blood, get the hemoglobin level up, and then hit them with radiotherapy and chemotherapy so that we can have better outcomes. Unfortunately, this has not been standard practice at Angau. And that's an issue that we are addressing with our blood bank so that we can increase our blood drives.
Globally, cancer will be the highest killing disease in the world in the next 20 years. In a more local perspective, more support is needed from the government and the private sector to make sure Papua New Guinea can prevent and contain the disease. There is also growing concerns for other cancers. Cancers of the breast and of the mouth need to be detected earlier so that treatment can work. Trainee oncologist Dr. Kathy Timothy had also explained the stark reality behind mouth cancer caused by the intensive chewing of buai.
Yes, breast cancer and even cervical cancer and some other cancers are also associated with the type of diet, they say. And with breast cancer, they say obesity is one of the associated risk factors, and as I've said, whether there's a clear-cut connection is something that needs to be researched and confirmed. But there is association that's been established by researchers overseas. We in PNG are not doing researches, as Dr. Niblet mentioned. At the moment, our focus and energy is on patient care at the moment, and there's not much effort put into research to confirm all these associations that we've known.
The other major cancer that we have in this country, which is both preventable and early detectable, is mouth cancer. And this is associated with betel nut chewing. And we believe it's the lime that causes the problem with regular and constant lime burns to the area where the betel nut is being chewed. And the biggest group of people now coming along with this cancer are from the highlands. It used to be only from lowland areas and in the island areas. But since betel nut has been exported to the highlands, there's been an explosion of mouth cancer.
Lay's Angao CEO Dr. Jim Abrams says plans to improve the only cancer referral facility has already begun and construction should start.
There are different types of cancer. Cancer also remains a significant cause of death, not only in PNG but across the world. In terms of cancer, we have very limited specialized doctors. These doctors have for so long faced with the harsh challenges in addressing the disease.
We see there is a large number of patients who don't get screened. If they get screened, they could be picked up earlier. And among women, the oral cancer is still quite common, and you have breast cancer, and cervical cancer is the most common among women. So, and in children you have more of the other malignancy like blood cancers, leukemias and things like that, which is more common among children.
So we do have a cancer screening service within the hospital, but not for every cancer, for specific cancers, mainly for the women. Okay, so cancer, it's a very expensive disease to treat. So we want to make sure we screen people with suspected cancer to make sure that they don't have it, so we prevent them from having it. Okay, not all cancers we are able to screen for all cancers, so we're only able to screen for specific cancers. In Port Moresby General Hospital, cancer of the breast and cancer of the cervix, we're able to at least screen for them.
I come late to Mass, yeah. Also come to stage 3, plenty time, stage 2, not at plenty, I come to stage 1. So me plus at the same time, me doctors at the same time here, because time old man come on time late stage blood cancer, and me treatment is hard, yeah. And me plus I talk sorry that's all. Ready him die blame you.
The patients we see here are the ones that come in when they already have a late stage of cancer. So stage 3, stage 4, it's late. So come in here expecting us to do miracles. We can't really do much. So what we do is just try to minimize the problem, and then at the end of the day, they still die.
Me as a doctor, I feel very sad especially when I'm doing endoscopies, when I'm seeing patients who present so late, where I can't or my colleagues can't do much about it, where the tumor is already spread. Sometimes I wish that person had come earlier. Sometimes I wish they had got medical help earlier. Because most of the cancers, as I told you, it's a multi-specialty care or multidisciplinary care, where different specialties are involved in taking care of the patients.
Cancer drugs are a little bit expensive. Some are not expensive to mass, but some are only expensive legally. But even the cheap ones, me play no god long. And you got one play cancer, you can cure him long marsim. Cancer is a come up long placenta. Mama got baby, placenta, and this is something is a give kai baby, yeah. We call him bilum blow pig in one time pregnancy no come up normal. Now this la placenta is a come up cancer. This is like cancer or Tango Mary is a die quick straight here because cancer one speed grows straight cancer. But this is like cancer you can cure him long methotrexate marsin. But at the time we play a short long methotrexate. And then we play last Christmas we go beg him or some NGOs in Australia helping me play long methotrexate. Because government no supply methotrexate on a regular basis now. And how sick long outside long Mosby or is contacting me, tell him some methotrexate me place I talk go long medical store bla you I no idea. So we're trying to get private. I mean, me same here. Lord is like kind of beg him all line long overseas long helping me play. But government when people are richer, natural gas billions and politicians have multiple houses and cars and first class air travel and feeling good plan or you may or big man round about us long business class time all people in Nogat Marsin.
Within the hospital to treat cancer patients. Right now in terms of treatment of cancer, we need three different kinds of doctors. Not three, but maybe 4 different kinds of doctors. A medical oncologist, a radiation oncologist, a surgeon, and the lab people, pathology people to help diagnosis. Okay. Medical oncologists in the country, we don't have any. I'm a physician taking up the challenge of dealing with cancer patients.
Experts are appealing to the government to help ease some struggles that cancer patients and their families are facing by improving the cancer services that are in the country. They also extend a word of precaution to people to take responsibility of their own bodies to help prevent cancer. If you would like to make any donations to Lucy or Little Thoa Managa, you can contact us for more details using the address on your screen or visit us on our Facebook page. We would also like to thank the doctors of Pacific International Hospital, Port Moresby General Hospital, and Angao Hospital for your participation. For now, enjoy the rest of your viewing.